Christian McCaffrey was ruled out of the Sunday Night Football game with an injury, and while the good news is that it does not appear to be related to his Achilles, the bad news is it could be in fact a ligament injury in his knee. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach more about the medical side of the sports world. So Christian McCaffrey, we saw him leave tonight's game. There was initially concern about the Achilles. Seems like it's really, in fact, the knee. And I believe injury occurred on actually the play prior to when we saw him limp off the field. Right here as he landed on that right knee. Now, when we actually saw him limp off the field, everybody saw this foot plant right there on the left side, saw this bulging outward in the Achilles and thought, oh my goodness, he's ruptured his Achilles. This is terrible. But this is not really a position that puts any excessive load on the Achilles tendon. We just see that calf come up like that because he's trying to slow himself, put all of his weight on that left side, based on, I suspect, something he was feeling in his right knee. Now, I will say with all this, I don't think we've officially seen right knee versus left knee, but all the signs of which side he seemed to be favoring. The play we saw earlier, I think this is the right knee, so that's sort of what we're going to discuss and talk about for possible mechanisms. So no, we don't see anything classic here for an Achilles rupture on that left side. That left calf just bulges up like that because he lands firmly on his heel, not in Achilles loading position, as he tries to slow himself and go down to the ground. Now, the injury I would be concerned about is actually a PCL sprain. So here, if we watch McCaffrey go down, keep an eye on that right knee. As he comes down, he's going to land directly on the front of his right knee. And specifically, it's going to be the front of the tibia, which is important for the mechanism that's going to be affected on the ligaments. His femur is going to be right here. The tibia is going to be going down in this direction. And this front spot that lands on the ground is going to be the tibial tuberosity, or that front top part of the shin bone. What that's going to do as he lands is that's going to put a force in this direction, pushing his tibia posterior relative to his femur. And this is a position that can injure the PCL ligament, which is the opposite ligament in the knee, compared to the ACL. This was the play. They then went off the field, and the first play he came back in trying to push off and run was when we saw him go down. So I do suspect this was where that injury occurred. Now, if we go to our biodigital anatomy tool here, let's talk about the PCL. So the PCL stands for posterior cruciate ligament. Posterior because it's in the back side of the knee, cruciate because it crosses. Similar to the ACL, the anterior cruciate ligament. If we go over and look at that one, that's going to be right here. And basically the ACL and the PCL have opposite functions from one another. The ACL is going to run in this direction. So what it's going to do is prevent the tibia from moving forward relative to the femur. The PCL runs in the opposite direction in this plane, and so what it's doing is it's keeping the tibia from moving posterior relative to the femur. That means that if you land on a bent knee and you have a direct force that comes in this direction, that's going to push the tibia backwards, which is going to put excessive stretch on that PCL, potentially causing a PCL tear or a PCL sprain. Now, PCL injuries are not considered as devastating an injury compared to the ACL. ACL tear, surgery, pretty much no question about it in an elite athlete. PCL, full thickness tear, sometimes surgery will still be considered, especially if there's additional injuries to things like the meniscus, this group of ligaments over here called the posterolateral corner. So it often depends on other associated injuries beyond just an isolated PCL. Other factors that will come into play here, though, will be time of the season, because if you have just a PCL sprain, that's something that's going to be treated conservatively, anywhere from a couple of weeks up to maybe a month or two, depending on the severity. But again, we're going to have some factors here about his health history, where the 49ers are in the season, and how much recovery time he could have. So not on paper as devastating an injury as an ACL tear, but certainly something that if it's a complete, he elects for non-operative management, is probably still going to be 3 months. Potentially something they talk about reconstruction, depending on any other associated injuries. So if we go back now and look one more time at the play where this occurred, think about that PCL ligament as he comes down, lands directly on the front of his knee. That force is going to drive the shin posterior relative here to the femur, causing potentially excessive stretch on that PCL. Now, there's other things, of course, just bone bruising that could have occurred. The PCL might just be fine, and he was just having too much pain to go back in. Similar to the ACL, we have a pretty good sense right away about the integrity of the PCL on just physical exam, and I expect we'll hear more after the game about, is this concerning or not concerning? But based on the injury replay here, that would be what I suspect. Let me know any questions or comments down below. Thank you as always for watching, and I'll see you in the next video.